One of our most common procedures is the single dental implant, meaning the patient has had one tooth that has failed or they have one tooth that is missing. It's our responsibility to provide them with options that exist for replacing that failing or missing tooth. One option is a dental bridge. A dental bridge, we crown one tooth on each side of the space, and we connect that with a floating crown. A better option for the patient would be just to replace that space with a dental implant. It means we do not involve any other teeth, which could lead to further complications. When we place a dental implant in that space, the patient's able to floss that area. It's just like having a natural tooth. Patients often come to me with multiple missing teeth in the back of the mouth from years of fillings and decay or lost bridges, but the front teeth are still in good condition. An option that we provide is to place multiple dental implants in those segments and restore that area. Our front teeth and our back teeth were meant to work together, and without those back teeth, those front teeth just start to wear faster than they should. Dental implants are the best long-term solution for our patients that are missing teeth. Not only do they help support the bone in the areas that they're placed, but they provide a strong foundation that's the closest thing to natural teeth.